Okay, so hey guys, today we will be learning about premature cervical dilation, which a very highlight about anemia 2020 2080 Pareto principle with the 80%, the 20% would lead to the 80% results. So one of that would be it is painless na pagdilation, and we kind of manage this with the cervical cerclage, which consists of two things here: the Shirodkar and the McDonald's. So what first is a premature cervical dilation? This is a painless, again, it's painless opening of the cervix around 12 to 14 weeks, often leading to preterm labor or miscarriage. So, what is the term labor pala? What is the term labor is 37 weeks. The age of viability is 20 weeks. So, I have heard something in the YouTube paghapon that says na if some babies who are born normally, term normal term, so more than 37 weeks, 37 to greater than, they could have lung problems. How much more are the babies who are born prematurely at risk for that? So painless opening of the cervix 12 to 14 weeks, often leading to preterm labor or miscarriage. So I'm thankful to God, Jesus Christ, because my mother has not experienced that. Yeah, I think with me. So understand the incidents, and I pray for Ninang. Oh my gosh, this is in YouTube, manggod. So I'm just gonna pray for my auntie who has this condition to be able to have the suture. So understand the incidence and cause of premature cervical dilatation. Premature dilation or dilatation. Dilation naman. So when we say, what is the difference with dilation and dilatation? So the incidence is 1 in 100 pregnancies. That's even shorter. So it causes, we should have um a incidence na table, because like I have 1 in 150,000 people ang ambot unsa to siya nga complication, but this premature cervical dilation is 1 out of 100 pregnancies. It occurs often when the cervix weakens and opens before labor starts, usually 12 to 24 12 to 14 weeks. 12 to 14 weeks. So the causes is increased maternal age, congenital maternal age. What does that mean? So babies pa sila. I mean, they are born with this. They are born with a weak cervix and trauma. Understanding the causes helps us identify at-risk individuals and plan appropriate care during pregnancies. So, which of the following factors is identified as a cause of premature cervical dilatation? Following factors identified as a cause of premature cervical dilation. So this factor is identified as a cause of premature cervical dilation. Gestation trauma. Identify the risk factors associated with premature cervical dilatation. Risk factors. So if you have this, so kanina is the cause, kayo naman is the risk. So if you have increased maternal age, this is women over 35, and congenital factors and trauma. So same lang. Is most associated with cervical dilatation. Increased maternal age ang most. Which of the following is a risk factor associated with premature? Increased maternal age. So how do we manage this? We have cervical cerclage involves stitching around the cervix. So Shirod-Gar is a permanent suture, baby delivered via C-section, while McDonald suture is temporary sutures removed before vaginal delivery. Which type of suture is used in cervical cerclage to permanently keep the cervix closed, requiring a C-section? Shirod-Gar sutures. Discuss the types of cervical cerclage, Shirod-Gar, McDonald. Permanent, temporary. McDonald's sutures kay temporary but it is removed para mag-vaginal birth ang mama sa 37 to 38 weeks, allowing delivery. So, which statement accurately compares Shirod-Gar? So, kaka-learn lang natin. Shirod-Gar is temporary? No, Shirod-Gar sutures are permanent and requires a C-section. Whereas McDonald's are temporary and allow for vaginal delivery after removal. So, examine the nursing responsibilities after cervical cerclage. After a cervical cerclage, it's important to follow these nursing responsibilities. So, the mother must have bed rest. Stay in the bed for a few days. Use a slight Trendelenburg position to reduce pressure on the cervix. So the Trendelenburg position is the feet is higher than the head. So it removes it reduces pressure on the cervix, as well as it is used when we would want the blood flow to be at the important ng mga organs, which is nasa taas. So vital signs: monitor blood pressure, pulse, and temperature for any signs of infection or shock. So hemorrhage ang magka-lead to shock, diba? Bleeding and contractions. Watch for vaginal bleeding, uterine contractions, or rupture of the amniotic sac. If contractions occur, tocolytic. So, dali ta mag-use of tocolytics. So, this is the opposite of oxytocin. Tocolytics, we have ritodrine, is used for us to maintain. So, mula siya katong hormone nga prostaglandin. But, yeah. Activity restriction, limit activities. After a cervical cerclage, which nursing responsibility is most critical for detecting signs of preterm labor? So, I feel like 28 ko atong quiz na mo kay wala ko nakabutang og katong restrict coitus after bleeding have stopped for 2 weeks. So, ako rin hibutang is restrict coitus for 2 weeks. What 2 weeks? When start? After bleeding has stopped, dapat. Ay, anyways. So, after a cervical cerclage, God bless our future na quizzes. I think mom is very particular, so I bet she would minus that. So, after a cervical cerclage, which nursing responsibility is most critical for detecting signs of preterm labor? Detecting man signs. So, preterm labor, rupture of the amniotic sac. So you really have to understand what is being asked, you know. And it's not just a matter of memorizing things. So explore common nursing diagnosis related to premature cervical dilation. Common nursing related to premature cervical dilation include anxiety, injury risk for maternal, injury risk for fetal, grieving, anticipatory knowledge deficit. So this diagnosis addressed the physical and emotional concerns associated with premature cervical dilation. So which nursing diagnosis is most appropriately paired with situational crisis of fetal loss and premature cervical dilation? I admire the courage, but seriously, no thank you. Which nursing diagnosis is most appropriately paired with situational crisis of fetal loss and premature cervical dilation? Nursing diagnosis most appropriately paired with situational crisis of fetal loss and premature. Oh, nursing diagnosis, situational crisis, anxiety. So, muna ang mga common na nursing diagnosis. So, anxiety, situational anxiety related to situational crisis to fetal loss. So we have to note sa mga nursing diagnosis pa di ay, because that has not been nasa PDF. So injury risk for maternal surgical interventions and use of tocolytics related to surgical interventions and use of tocolytic drugs. So yeah, premature delivery and the surgical procedure. Based on the recommended nursing interventions, which approach is most appropriate when caring for patients experiencing anxiety related to premature cervical dilation? Identify the client's perception of threat and explaining the situation, but not remaining with the couple or assessing physiologic Identify the client's perception of threat, encouraging expressions of feelings, assessing physiologic indicators, remaining with the couple for support, and explaining the situation. Identifying the client's perception of threat, encouraging expressions of feelings, assessing physiologic indicators, remaining with the couple of support, and explaining the situation, which nursing is specifically used to address anxiety in a patient experiencing premature expression of feelings. Identify the client's perception of threat. So that's it with the premature cervical dilations. Let's go over with placenta previa. So we have 6 steps here. Define placenta previa. It's the low implantation of the placenta, the word unusual. The opening of the cervix, which is crucial for delivery, is the cervical os. It's a condition where implants abnormally low, potentially covering the cervical os, leading to bleeding and complications during delivery. There are 4 main types of placenta previa. We have total, partial, low-lying, and marginal. So, pila ka inches, pila ka centimeters is the placenta placed in the low-lying placenta previa. That's 2.5 centimeters from the cervical os, while the marginal placenta previa is near the edge of the cervix. So, asay mas duol sa edge? Ang low-lying or ang marginal? I feel like ang marginal because like it's naka-state that it's very near. The partial placenta previa is partially covers, while the total placenta previa completely covers the cervical os. So if a doctor's examination reveals that the placenta is positioned such that its margin is, that's low-lying placenta previa. Or lying. The main signs and symptoms of placenta previa include sudden painless bright red vaginal bleeding, often without any obvious trigger. This bleeding may stop and start or be constant, so sudden painless bleeding, bright red brown without pain. So which of the following describes the typical bleeding pattern observed in placenta previa? It is spontaneous, painless brown? No. Sudden painful? No. Sudden painless bright red vaginal bleeding that may stop and start to be constant. So this is really fast. Immediately shine and symptoms niya sa placenta. Predisposing factors of placenta previa. So predisposing is like we cannot change this. This has been something that is natural. So there are several factors that puts you at risk for developing placenta previa. Previous molar pregnancy, yeah, non-viable pregnancy, sayang. Endometriosis, so infection of the uterine lining. So we also have ectopic pregnancy, endometriosis, which is na outer lining, ang lining of the uterus kinasa outside of the uterus, so imbis sa sulod. So previous C-section, history of cesarean section, previous abortion, multiple pregnancy, multi-party, advanced maternal age, and decreased blood supply to the endometrium. So which of the following predisposed the blood supply to the endometrium? apply to the endometrium. So, balikon sa good. Wala, gamay siya. I don't know. Pero like, placenta previa katong, di ba, low infection. Multiparity, so having multiple previous pregnancies would cause you to have placenta previa because, you know, katong gi-visualize na drawing ni attorney Gab na you should watch his video. So like nadara ga implant sa first sa taas. So kay kadaghan 4 times na siya nag pregnancy. So asa naman mo implant ang placenta because pilian mo ng placenta. So sa pinakaubos na siyang implant kasi wala pa na previous implantation dito. So bed rest on the left side lying position to enhance placental perfusion. Which of the following nursing interventions is specifically recommended to enhance placental perfusion in a patient with placenta previa? Bed rest in left side lying position. Bed rest raka. So, sa tong nasa bed rest in left side lying position. So, that's how we manage placenta previa. So, what are other kinds of management? So, if, for example, you are asked a question, give 2 kinds of management and nursing care for placenta previa. So, monitor the amount of bleeding, vaginal bleeding, amount of color, including assessing the clots. So, bed rest on the left side lying position to enhance perfusion. Which of the following management strategies for placenta previa is intended to enhance placental perfusion? So, bed rest at left side, So, complications of placenta previa. Complications of placenta previa can be severe for both the mother and the fetus, often requiring immediate medical intervention. Here are the key complications: hemorrhage, excessive bleeding from the placenta, complications often requiring immediate infection, increased risk of infection, prematurity. The risk of prematurity often leads to early delivery of the fetus. So, what do you mean complications of placenta previa? So, yahang resulting. Which of the following complications of placenta previa is specifically associated with an increased risk of infection in the uterus after placental detachment? After placental detachment, so nasa increased risk of infection in the uterus. Infection.